Attention chiropractors, slayers of subluxation, unleashers of the imprisoned impulse. I am Dr. Anthony Pellegrino from ChiroEdge, and welcome to this week's episode of the Chiropractic Research Breakdown, where each week we break down the most relevant chiropractic science and philosophy to empower you with the ammo and certainty necessary to change your community from the inside out. Today we're going to go over a case study, which means I'm going to get excited because I only go over case studies when I really love them. It's called Resolution of Psychogenic Non-Epileptic Seizures Following Chiropractic Care, a case study and review of the literature. This is from the QSM3 team, Quantum Spinal Mechanics Cubed, Dr. Russell Friedman and Dr. Sean Puro, who is somebody I went to school with and just always appreciated his writing about this topic. Super fired up about chiropractic care and the implications of correcting subluxation on human potential. When I look at keywords for an article and I see the words adjustment, chiropractic, vertebral subluxation, cervical, tonal-based, and biotensegrity all in one article, I start to get really fired up. What we should know is that psychogenic disorders are very difficult for the medical community to manage, because what psychogenic means is that it's usually that these patients are usually told this is all in your head. They are discharged, they are sent from person to person, they are drugged, they are sent elsewhere, and they are not cared for. Their underlying self is oftentimes not looked at. Psychogenic non-epileptic seizures is often misdiagnosed and overlooked, even though in our society it is as common as multiple sclerosis or trigeminal neuralgia. 3/4 of all patients with psychogenic non-epileptic seizures are females. According to the DSM-4, it is a functional neurological disorder and conversion disorder. Let's just go into this and talk about this. A thorough diagnostic assessment of patients with psychogenic non-epileptic seizures should include all of these factors. Otherwise, and I quote, otherwise treatment may be less likely to succeed. For the first part, number one, there's 5 factors we're going to look at. Many patients with psychogenic non-epileptic seizures have other psychiatric disorders, most commonly somatoform or dissociative disorders, affective anxiety, and post-traumatic stress disorder. Many patients show abnormalities of personality development, especially borderline personality disorder. Many patients have organic brain disorders, most commonly epilepsy and learning disability. Psychogenic non-epileptic seizures are occasionally first observed after epilepsy surgery or other neurosurgical procedures, especially if there were post-operative complications causing prolonged hospitalization. Psychogenic non-epileptic seizures commonly occur in the context of social or family conflict and trauma, and psychogenic non-epileptic seizure patients often have a history of sexual or physical abuse in childhood and in adolescence. Essentially, this patient is dissociating and shutting down and separating from their traumatic past, and when they overflow, it's coming out in seizures. Many of you guys, if you've been listening to this podcast, know how strongly I feel about chiropractic and mental health, and this is especially important for me. There are tests and in professional settings you can take it, or you can go online and take it yourself, where you can actually look at dissociative tendencies. How likely are you to, in times of extreme emotional stress, likely to shut down and move forward? I myself have been told by many people, hey, it doesn't seem as though, no matter what's going on in your life, it seems as though you're always just coming to the table. And the thing is that it's not necessarily my positive self that allows me to do that, but testing shows that while I might not have like a dissociative personality disorder, I certainly have some dissociative tendencies. It's actually part of myself and something that I'm personally working on to stop completely shutting down in times of immense stress. And it seems as though, upon inspection, many of my own reasons and causes and contributions to why I might do that, or contributions to even why I'm passionate about this in the first place, is because of the physical abuse that I have experienced in my own childhood. So when I hear stories like this, when I meet individuals like this, it becomes part of who I am to help them. And I hope that by going over this research with you, I can help your community as well, because it's extremely important. Because nobody else, believe it or not, does what we do, and nobody else can help these patients in the way that we do, which is by literally helping to reprogram, to rewire how their nervous system is going to perceive physical, chemical, and emotional stress by correcting aberrant proprioceptive information going from the spine to the brain. We need to have this confidence, guys, to help these individuals, because it's not just in their head. Okay, so let's go ahead and review the case. 30-year-old female, that's how old I am, is somebody who has a chief complaint of full-body convulsions. She'd been diagnosed with non-epileptic seizure disorder. She experienced serious autonomic dysfunction, which included symptoms of lightheadedness, feigning without loss of consciousness, heavy chest compressions manifested from anxiety, and loss of vision lasting 30 to 45 seconds. At the time of our initial diagnosis, she would have episodes of complete loss of motor function in her legs, headaches, dizziness, nausea, fatigue, and tremors. It started at 3 times a week. She went to her doctor, she went to her internist, she was diagnosed with a seizure disorder and POTS. After a month of meds, they found it wasn't effective. She was still experiencing the above symptoms and convulsions, but they began happening 4 to 5 times a day and lasting 5 minutes to an hour. The autonomic issues originally had led them to believe that this was because of postural orthostatic tachycardia syndrome, but they ruled that out and then newly diagnosed her with a conversion disorder. She started doing cognitive behavioral therapy. Upon presentation to the chiropractic clinic, symptoms had gotten about 80% worse during this time. Triggers that led her to episodes of convulsions were anything from sleep deprivation, which could last 3 to 4 days, night terrors that were occurring 3 to 5 times per week, contributing to insomnia, certain light patterns, velocities, noises, periods of decreased appetite would elicit a convulsive response, and convulsions had moved up to about 6 to 10 times per day, and were lasting 20 minutes to an hour. They started adjusting her upper cervical using QSM3, which in my limited understanding, so please bear with me or put in the comments if you want to talk about it. Correct me if I'm wrong. Send me a message, whatever you want to do. They started adjusting her, and with QSM3, which is a 3-dimensional postural change, which measures for 3-dimensional postural changes using the upper cervical area, not the bone, though. The bone, I do not believe that they believe is a subluxation, but rather they address this global postural change using upper cervical fascia. After the first adjustment, the patient's convulsion with preceding symptoms had ceased for 2 days. At her second visit, they note that, and I like this quote here, postural analysis showed that she was slightly holding her adjustment, but her body kept trying to move her into a subluxated pattern due to prolonged trauma misalignment. After the adjustment, none of these symptoms had been apparent for 10 days, and she had a convulsive episode, which she said lasted no longer than 5 minutes. After 7 months, we've seen significant decrease in frequency and convulsions with related symptoms, and she's on wellness care for twice a month. So this is pretty awesome, guys. What I love right now is that you can literally go into one of your bookcase or whatever. If you're a student, you can go into your library. You can go to Guyton's textbook of physiology. Guyton's textbook of physiology, not chiropractor's textbook of physiology, not the Reggie Gold textbook of physiology, not a green book. You can go to Guyton's textbooks of physiology right now. You can open it up to the section about the nervous system. You can begin reading about the spinal mechanoreceptors, specifically upper cervical area. It's right in there. I've read it myself. You can look at the tracts. You can trace the spinal tracts that will carry information, aberrant proprioceptive information from the spine, from the body, up the tracts of the spinal cord, and will begin bombarding the frontal cortex. How you can go ahead and read right in Guyton's textbook of physiology, how after the cortex receives this information will branch off. It'll affect the visceral nuclei. It'll affect the motor nuclei. It'll go through the hypothalamus. It'll go through the brainstem reticular formation. You can go ahead and read right in there how the hypothalamus and how the reticular formation coordinate physiological responses to emotional stress. You can look at and you can read how the cortex affects the amygdala and the limbic system. How it sends off somatic and visceral modal signals which integrate emotional responses. You can look at and read, go right to that section and read about how the thalamus affects the pituitary gland and how improper function of the hypothalamus is going to cause improper function of the pituitary gland and is going to cause improper function of the adrenal gland through something known as the HPA axis, the hypothalamic pituitary adrenal axis, and how this is going to completely throw off the function of our immune system. You don't have to go to a chiropractic textbook and read that. You can look at that and trace that and literally draw from paragraph to paragraph in the textbook that you're going to take in your physiology classes, the very same textbook that's handed out in chiropractic colleges, in physical therapy colleges, in OT, in MD, in whatever medical profession out there, in simple basic anatomy classes, because it's not chiropractic physiology. It's just anatomy and physiology. You can go into Guyton's textbook physiology right now and you can just throw it in yourself right in the columns the word subluxation. You can go to Dr. McCoy's journals, to the Journal of Upper Cervical, to the Vertebral Subluxation Research, and read right now how individuals who are gently and specifically correcting not joint dysfunction, not randomly manipulating the spine, but actually going in there and analyzing and correcting vertebral subluxation are affecting not only the aches and pains of the body, but literally changing emotional responses, physiological responses to physical, chemical, and emotional stress. You can do that right now in their textbooks. Not in our textbooks, not in chiropractic textbooks, in medical textbooks. You can do that right now. You can go on PubMed and do a quick heart rate variability search and look at how their research, the pharmacological research, medical doctor research is supporting how improper adaptability of the nervous system, which they measure with heart rate variability, the exact same measurements that chiropractors around the world are using to quantify changes in the adaptability of the nervous system following specifically correcting subluxation. You can read how disruption of heart rate variability will affect everything from metastasis of breast cancer to anxiety and depression. You can do that right now. And you can start to ask your patients how they've seen changes with these things, and you can know that it's not in their head, it's not a placebo, it's not because your staff is really amazing, it's because you're correcting subluxation and allowing their brain and their body to communicate properly, and these are the outcomes that happens when we do that. Yet we have a profession where we want to move away from this and move towards achy low backs and hurt feet. We have a profession that will go on rants, and will go on Facebook debates about skincare products, the ingredients to vaccines, the perfect supplement or keto diet that will change the world, and how important that all that is. Yet those very same people go back to their community and they flying seven a bunch of people and think that they need to give people foot baths, colon blow, ketosis, and supplements in order to actually get changes in these things. And they're wrong. Imagine if they cared as much about the quality of the adjustment as they did about the GMOs in their Juice Plus. Imagine, what would our profession look like? What would your community look like? It's just mind-blowing to me that we have people like Dr. Friedman and Dr. Puro who are getting ridiculous results by doing nothing other than being ridiculously specific. Yet people don't want a part of that. How do you not want a part of that? Don't you want to be able to publish results like this from your office? Don't you want to change the health of your community with results like this? Don't you want to help people literally change how their body perceives physical, chemical, and emotional stress? Can we stop worrying about how level our shoes are and start freaking correcting subluxation? Please. It's time. Our research supports it. Their research supports it. We're the only ones who deny it. Step up. Be specific. Go to a seminar. Go to CBP. Go to QSM3. Go to NUCA. Go to TRT. Go wherever you want. Figure out, Gonstead, sorry. Figure out how the heck to find and address subluxation and measure and quantify neurological change and do that and just do that and watch your community change and watch people tell their friends and family because they're not confused. The message isn't confused. They know it's the adjustment. They know it's chiropractic. They know it's correcting subluxation. It's causing these changes, and we're going to get more people under chiropractic care. Stop going wide, going 1 inch wide, 1 mile deep, correct that subluxation, and change your community. I'm Dr. Anthony Pellegrino from ChiroEdge. I apologize for yelling at you today and getting a little fired up with this. If you're a student, go into Guyton. If your teachers deny subluxation, challenge them. Hand them stuff like this. Hand them the larger RCTs that we have. Tell them that you will not accept the bull. Publish your own research. Quantify. Look at HRV. Look at thermal. Look at SEMG. Look at these things. Quantify it. Publish it. And let's do it together. Thank you guys so much for listening. Go out there, slay those subluxations. I love you. Get information like this straight to your inbox at chiroedgemedia.com.